Hello. Thank you all for giving me the opportunity to talk. I am the head of the Neuroimmunology unit at Hadassah University Hospital in Jerusalem, and I do not have any specific disclosures to this presentation. I do not have any financial relations with the Brainstorm after our very old phase 1/2 clinical trial back in 2012. My motivation to talk in this meeting is since we have so much experience. I think one of the best experience with the use of different types of mesenchymal stem cells in ALS, starting from 2006, the regular type of mesenchymal stem cells, and also I was involved in this study with Brainstorm, which was a phase 1/2 trial, in which 14 patients were treated intrathecally with the NurOwn cells, patients with ALS, and 6 intramuscularly only in one hand, and 6 intrathecally in the first phase 1 trial. So in total, we had 26 patients. From them, I would like very much to share with you the long-term safety observations that we have with these patients, and also about the survival rates. First of all, it is interesting that now, up to 15 years after the trial, we have not seen any unusual side effect. So this is a very good signal for the safety, the long-term safety. But what was extremely, or I say highly unlikely, is that the percentage of patients still alive after 15 to 16 years from the onset of the disease is close to 50%. 9 out of 12 patients treated intrathecally, they are still alive and partially functioning. And this is, to my knowledge, very unlikely as compared to any other cohort of ALS patients. And this is also further confirmed by additional 12 patients who were treated 10 years ago with regular mesenchymal stem cells, and still we see very high mortality survival rates of 9 out of 12 being alive more than 10 years. I believe that this safety and mortality data are very important, because real-life information, observation, especially in the long term, can provide sometimes the clues in order to see whether, especially in that rare diseases, orphan diseases like ALS, we can use a different type of treatment. Otherwise, I would say that there are other examples, like medications in myasthenia gravis, eculizumab, which was negative in the primary endpoint and is used in specific subgroups of myasthenic patients, and also a lot of medications used in secondary progressive MS, despite the fact that the initial studies have been negative. So my view is that NurOwn cells can provide, both in terms of safety and mortality rates and efficacy, much more than the existing therapies for ALS, and should be approved as an alternative option for this orphan disease. Thank you very much.